To the RX Care channel, where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button. That way you're able to help support our community here at the RX Care. And also you'll be able to get alerts anytime we post our other educating videos regarding medications or other condition of choice. All right, so let's step right in and talk about the medication or our treatment of choice today. So today we'll be talking about treating a stomach bug or food poisoning in our patients. So what is a stomach bug, or what is termed as a food poisoning? So usually patients will have symptoms such as diarrhea, as well as stomach cramping or intestinal cramping. Patients may have nausea, vomiting, fever, as well as increased thirst when they're having stomach bug or they're having symptoms of food poisoning. So these are characteristics that you might have a food poisoning going on, or you might have been infected with a stomach bug. So usually the diarrhea is more pronounced in this patient. And about how long does it last? So it lasts about 1 to 3 days. So how do we know, or what is causing that stomach bug or food poisoning patient? So usually patients who have been exposed to bacteria or a viral infection through food, these are patients that usually present with a stomach bug or food poisoning in our healthcare setting. So usually the bacteria that usually is very common when it comes to food poisoning would be like our E. coli or Salmonella, Shigella. Those are common bacteria that can cause food poisoning in patients. Also, patients who are used to eating undercooked meat or fish, such as like sushi, these patients are more likely to have a food poisoning or a food bug. However, this is not always, a common side effect that happen, but you are most likely at risk for having a stomach bug or food poisoning for eating, like I said, undercooked food. So when patients have food poisoning or a stomach bug, our main treatment in this patient is try to avoid dehydration. So as you already know, these patients are having diarrhea or they're having nausea and vomiting, and they're not able to keep liquid in, which means that they're excreting their electrolytes as, they're using the bathroom. So the main goal is to make sure that as they're, getting rid of those electrolytes and their stomach is trying to regulate itself after being exposed to that viral infection, our goal is to make sure that we're replenishing that electrolytes that they're losing. So a way for us to do this is by making sure that the patients are drinking another electrolyte replacement, such as like your Gatorade, Pedialyte. Also, some patients might prefer to go the homeopathic route, which would be drinking a ginger tea or non-caffeinated tea to kind of help their stomach be calm. Also, patients want to get plenty of rest around this time, just to kind of get your body in that rest mode to kind of help replenish that energy, as well as help your stomach re-regulate itself. So after treating that stomach infection or viral infection, like I said, the treatment goal is making sure that the patients are not dehydrated and we're replenishing those fluids or those electrolytes or minerals that their body is getting rid of as it tries to get rid of that viral infection. So in this patient, once that symptoms reduces, then you want to kind of slow down when it comes to, eating back your regular meals. So what are some of the foods that you want to eat after having a stomach bug or food poisoning? So those food would be like light or a bland food, such as like your whole grain rice. So you want to make sure that you're eating maybe something like an applesauce or banana or potatoes, something that will be more easier on your stomach. So you don't want to go from having a food poisoning or a food bug to, eating another meat, because your stomach is already trying to, re-regulate itself. So you want to kind of ease yourself into what food that you're going to be eating after that food bug or food poisoning, reduces. There's not really a medication to help while you're having that food poisoning. You just want to make sure your stomach kind of let it run its course and just kind of get rid of that infection by itself. That way, you re-regulate. And then after the food poisoning, you can think of options such as probiotics to help kind of replace your stomach flora with some good bacteria after you've, gotten rid of some. So what are some severe food bug or food poisoning symptoms that you want to look out for that is a cause of alarm, where you want to make sure that you're reaching out to your healthcare professional immediately? So this would be severe diarrhea in terms of bloody stools. That you definitely want to make sure that you're calling your doctor immediately to see if they have to, admit you into the urgent care or the hospital, or they can run more diagnostic screening to see what's going on. Or if you have a fever greater than, 100.4 degrees Fahrenheit or 38 degrees Celsius, then you want to make sure that you're reaching out to your doctor immediately. Also, if you've been having the diarrhea for more than 3 days and it's, straight up going to the bathroom consistently, then you want to make sure that you're reaching out to your doctor. Or if you've been outside of the country recently and, you suspect that it might have been a food that you had when you were outside of the country that may have been that source of the food bug, then you definitely want to reach out to your doctor and say, hey, I've been outside of the country. I think I might be exposed to a bacteria infection. That way, they can prescribe antibiotics or take it to the next level in terms of prescribing something to help your body quickly, replenish itself or treat that infection. You want to make sure that you're reaching out to your doctor immediately if you've been outside of the country. That way they can prescribe like an antibiotic or another medication that will help treat your body and fasten that process of recovery. All right, so what are food that you want to prevent in general when it comes to prevention of food bug or food poisoning? So this would be healthy, fully cooked meals, as well as making sure that you're employing some good hand hygiene, making sure you're washing your hands properly, getting rid of any dirt underneath your fingernails. That's very important, as well as making sure that you're refrigerating your perishable foods immediately or within an hour of using them or opening like the can. That way you can help preserve it and it doesn't become, infested with like bacteria or an infection and cause a food bug or food poisoning later on. All right, so I hope I was able to help you in terms of what to look out for when you have food bug or food poisoning. You definitely, like I said, want to employ those good hand hygiene, especially when you're going out of the country. You want to make sure that you're eating something that you're familiar with, as well as also making sure that you're not eating fruits that are open or fruits that you have to eat the shell. Make sure that you're eating like fruits that are well covered or that you have to break the shell before you even actually get to the actual fruit that you're going to eat. So making sure you're eating fully cooked meals is also important as well. All right, so I hope I was able to help you in terms of what to look out for in order to prevent, and also in terms of treating a food bug or food poisoning. Thank you for watching, and if you have not yet done so, make sure you hit the like and subscribe button. That way you can help support our community here at Demi RX Care. Thank you and stay blessed.